Welcome to a deep dive into the human psyche. Today, we delve into borderline personality disorder, as defined by the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, also known as DSM5. Borderline personality disorder, often abbreviated as BPD, is a mental health disorder that impacts the way you think and feel about yourself and others. This disorder typically involves instability in mood, behavior, self-image, and functioning, which can result in problematic and often turbulent relationships. The Diagnostic and Statistical Manual of Mental Disorders, 5th edition or DSM5, is a critical tool used by mental health professionals worldwide. It provides standard criteria to classify mental disorders, including BPD. The DSM-5 outlines 9 specific criteria for BPD, 5 of which must be met for a diagnosis to be made. These criteria include a pervasive pattern of instability in interpersonal relationships, self-image, and affect, as well as marked impulsivity. This means that individuals with BPD often struggle with self-image, have difficulty maintaining stable relationships, and may frequently experience intense and volatile emotions. They may also demonstrate impulsive behavior, such as reckless driving or substance misuse. It's also important to note that BPD is quite prevalent. According to the National Institute of Mental Health, about 1.6% of adults in the United States have BPD in a given year. Despite this prevalence, BPD is often misunderstood and stigmatized, making it essential for us to deepen our understanding and challenge misconceptions. In our exploration of BPD, it's crucial to remember that this disorder, like many mental health conditions, is a complex interplay of genetic, environmental, and social factors. It's not a character flaw or a sign of weakness. People with BPD are not bad or unstable. They are individuals navigating a challenging mental health condition. With this understanding of borderline personality disorder, we can start to peel back the layers of this complex condition. Now that we've established a foundation, let's delve deeper into the symptoms of borderline personality disorder as per DSM-5. This diagnosis is characterized by 9 distinct symptoms. Firstly, there are frantic efforts to avoid real or imagined abandonment. This means people with this disorder may go to extreme lengths to avoid being left alone, even if the threat of abandonment is not real. Secondly, a pattern of unstable and intense interpersonal relationships is common. This could mean a rapid fluctuation between idealizing and devaluating others. Thirdly, identity disturbance often manifests as a markedly unstable self-image or sense of self. Impulsivity in at least 2 areas that are potentially self-damaging is another symptom. This might include reckless driving or binge eating, recurrent suicidal behavior or threats, emotional instability due to a marked reactivity of mood, chronic feelings of emptiness, inappropriate intense anger or difficulty controlling anger, and transient stress-related paranoid ideation or severe dissociative symptoms are also present. These symptoms paint a picture of the inner turmoil experienced by those with borderline personality disorder. So, we've unpacked the DSM-5's definition and symptoms of borderline personality disorder. But who does this disorder affect? In essence, borderline personality disorder, or BPD, is a serious mental health disorder marked by a pattern of ongoing instability in moods, behavior, self-image, and functioning. These experiences often result in impulsive actions and unstable relationships. But let's not forget, this disorder does not discriminate. It can affect anyone, including the brightest minds of our time. Actress Winona Ryder, known for her roles in Stranger Things and Edward Scissorhands, has openly discussed her experiences with BPD. Similarly, singer Pete Doherty, frontman of the Libertines and Baby Shambles, has also publicly spoken about his diagnosis. Their stories remind us that mental health disorders are not a sign of weakness or a character flaw. They can affect anyone, regardless of their success or genius. Borderline personality disorder, a complex mental health disorder that can affect anyone, even the sharpest minds among us. Remember, understanding is the first step to empathy and support.